All right, my name is Megan Gregory, and I will be doing my presentation on dehydration and malnutrition with thickened liquids. So here's just a brief introduction. Patients with dysphagia are often put on a thickened liquid diet for multiple reasons. They might have impaired bolus manipulation, sensory deficits, delayed swallow response, compromised airway measures, and really importantly, a risk of aspiration or penetration. So although thickened liquids are necessary in some cases, SLPs need to be aware of the risks that they pose. So here's a review of thickened liquids. There are three main types: nectar, honey, and pudding thick, pictured below. So as you can see, these are really thick compared to your typical thin liquid such as water. So there are many risks of dehydration and malnutrition when patients are put on a thickened liquid diet. Their quality of life, physical and cognitive abilities might be decreased, their overall recovery, they're more at risk for infection, function decreases, an extended stay in the hospital, headaches, respiratory rate, dry mouth, and blood pressure. They also need to consider that they might be on some common medications such as antipsychotics, sedatives, and anti-inflammatory medications, which increase water loss. So a study asked for some patients' experience over a 2-week time period when they were on thickened liquids, and they reported that there was poor taste and texture with the liquids. They had dry mouth and they didn't feel like their thirst was quenched, even if they were on an IV for fluids. They had non-compliance rates from 40 to 80% also shown in the study. They felt that they had limited authority in the decision to be on this diet. They had little education on this diet and why it was necessary, and just overall unpleasant drinking and eating experience. Now, they did understand that there was some improvement with their swallow, but that was variable between patients and their cognitive level. Another study in Australia surveyed 600 SLPs, dietitians, and nurses for their experience. So they saw that there were no concrete measures for dehydration screenings, especially in stroke patients, as compared to their malnutrition screenings. Um, they also saw that there was a lack of monitoring of fluid intake and how thickened liquids were supplied, because the viscosity level could be different depending on what thickened liquid is used, how it's supplied to the patient, and how it's made. And they also saw that they relied on patient report for signs of dehydration, even though some of the patients might have decreased cognition. Now, the role of the clinician. This ultimately is the SLB's decision for this diet, because we're looking out for the risks for aspiration and penetration and other dysphagia symptoms. But we need to be monitoring our patients because we are the ones who placed them on that diet. So we need to be checking in with the other healthcare professionals to make sure we're checking in. We can try the free water protocol, see about giving them sips of water in between thickened liquids to help quench their thirst, and to help with oral hygiene. Uh, we can try textured thin liquids, which is 50% thin liquid and 50% nectar thick. Howard in 2018 found that this increases satisfaction, hydration, it helps normalize viscosity levels, and for his patients, there were no aspiration. Also, overall, we just need to take heed of the patient's wants, their family's wants, the MBSS results, the bedside swallow eval, and their age and just their quality of life determine what's going to be least restricted for them, what is most realistic for them to carry out, and what's going to help keep them healthy and safe. And here's my works cited. Thank you.